Think of the human brain as a massive, high-performance engine. To keep it running, it relies entirely on an intricate, sprawling network of blood vessels, delivering a constant supply of oxygen and nutrients. For decades, doctors have known that high blood pressure wreaks havoc on this delicate plumbing. Hypertension damages the vessel walls, leading to strokes and accelerating cognitive decline, particularly when it starts in middle age. This established biological reality led the medical community to a logical assumption. If high pressure causes the brain to decline, then prescribing medication to aggressively lower blood pressure in older adults should halt dementia in its tracks. The mechanics seemed straightforward. If you take a patient with severe hypertension and drop their systolic blood pressure below 120 millimeters of mercury, you stabilize the turbulence. You return the system to a steady, calm flow, theoretically preserving the brain's infrastructure. For years, researchers treated this highly targeted medical intervention as the straightforward solution for late-life cognitive decline. To prove this theory, scientists launched two massive, real-world experiments: the SPRINT Mind trial in the United States and the STEP trial in China. The STEP trial specifically recruited thousands of hypertensive older adults, targeting patients aged 60 to 80 who were at high risk for vascular issues. Researchers split these participants into two groups. As you can see in this breakdown, the first cohort received standard treatment, aiming for a blood pressure target between 130 and 150. The second group received intensive treatment, pushing their blood pressure much lower, between 110 and 130. Clinicians then tracked the participants' health and tested their cognitive function over a median period of 3 to 5 years. Looking at this stroke risk trend line, the vascular results were exactly as expected. The intensive treatment group saw a significant reduction in strokes and major cardiovascular events. But when researchers mapped out the global cognitive function tests, like the mini mental state examination, on this second chart, the standard and intensive groups scored almost identically. The intensive medication successfully fixed the body's plumbing and protected the heart, but it failed to save the brain from dementia. If the brain relies entirely on blood flow to survive, why didn't fixing the blood pressure stop the cognitive decline? The answer lies in a biological reality known as mixed dementia. Dementia involves multiple pathologies happening at once. It combines vascular damage with neurodegenerative diseases, including the sticky buildup of toxic amyloid beta plaques that slowly suffocate brain cells. Lowering a patient's blood pressure with medication is a narrow biochemical response. It reduces the physical stress on the vessel walls, but it does absolutely nothing to clear out those toxic proteins or halt the cellular breakdown occurring in the brain tissue itself. When confronting a complex, multi-system failure like dementia, prescribing a single pill to fix a single metric is biologically insufficient. If managing blood pressure isn't enough, researchers needed to find what actually works. The answer emerged in the FINGER trial, published in The Lancet. Instead of measuring one solitary metric, the FINGER trial tested a comprehensive lifestyle intervention. They combined diet, exercise, and cognitive training into a single, coordinated defense strategy. The nutritional foundation of this strategy is the MIND diet, which targets the precise neurological mechanisms that blood pressure medication misses. The diet prioritizes foods rich in specific compounds, like the flavonoids found in berries. These natural molecules actively enhance the plasticity of your synapses and reduce the neurotoxicity caused by amyloid plaques. It also incorporates continuous intake of leafy greens and fish, providing the exact micronutrients the brain uses to build physical resilience against cellular aging. Finally, exercise and sleep act as the catalyst for this biological engine. Physical activity increases cerebral blood flow to deliver those essential nutrients, while deep sleep activates glymphatic clearance, a biological process that physically washes away pathological proteins and cellular waste while you rest. Controlling blood pressure remains vital for reducing the risk of a stroke, but to maintain true cognitive function over a lifetime, you cannot medicate a single number. You have to defend the entire system.